by the Robin Nyman Mikvah Education Fund. My name is Renee Seidemann, and I am a member of the Robin Nyman Mikvah Education Fund Programming Committee. I would like to extend a special welcome to our community Rebbetzins who are joining us this evening. For those who did not know her, Robin Nyman Aleh Shalom was the manager of the Wasserstein Mikvah in Silver Spring before her patira over a year ago. She was a renowned mikveh educator, a dynamic teacher, and social worker who transformed the mikveh experience for women in many parts of the country. In 2020, the Mikvah Emunah Society established the Robin Nyman Mikvah Education Fund to honor Robin's memory and perpetuate her legacy. We hope that our efforts pay tribute to the significant contributions she made to our community, especially to the practice of Taharat HaMishpacha. The fund is dedicated to training mikvah attendants and greeters in our community and beyond, providing Taharat HaMishpacha and related educational programming, and sponsoring classes for brides in the greater Washington, D.C. community. Thus far, we have held a 5-part Taharat HaMishpacha refresher class completed by 75 women, trained 10 mikveh attendants, contributed to a national OU mikveh attendant training, and provided 2 local collars with collar classes free of charge. The Robin Nyman Mikvah Education Fund Programming Committee, made up of women from almost all of the shuls in our area, cutting across all age groups, has been planning a series of online events, and this is the second in the series. If you missed the first event with Mrs. Debbie Greenblatt, the recording is on our website under the events tab. Our next event will be for men and women on Wednesday, February 10th, titled From Quarantine to Connection, Strengthening Our Marriage During Challenging Times. Please mark your calendar.
I need that. It's not for you.
I want to remind everyone that this presentation is for women only. Thanks to Zoom, we have women who may be joining us from outside of our area. One of our goals over the coming months is to create achdut in our community around our mikvah. If you are in the greater Washington area, we would love for you to identify yourself by clicking on the reaction icon at the bottom of your screen and clicking on the clapping hand, or by waving with your camera on. Thank you. And if you are from the greater Washington area, here is a quick reminder that this is the time of year when we ask for your annual membership contribution to the Mikvah Emunah Society. We depend on you to ensure that the mikvah remains an integral part of Jewish life and of our local Jewish community. Your membership contribution ensures that we have funds to keep a safe environment for women to feel secure, especially during the pandemic, maintain our state-of-the-art facilities and equipment, and provide a clean and welcoming environment for all. You can find the link to the MES at www.mikvahemunah.com in the chat, and you can click there to make your membership contribution. Some housekeeping items. We have placed all participants on mute, and we ask you to keep yourself muted throughout the presentation. The Zoom's chat function is currently set up so that you can only send comments or questions to the host, that's me, and our tech support, Hai Chin. Once our panel speakers finish sharing their presentations, our moderator will ask them questions and guide a conversation. We hope to have time to get to your questions, but in case we do not, you will find the contact information for all of our speakers in the chat so you can follow up with them directly. One final and very important note. There are many issues that will come up this evening that touch on halachic matters. The Mikvah Emunah Society and our speakers are not providing halachic guidance, and we will not be answering questions on halachic matters this evening. We strongly encourage you to consult with your own halachic authority should you need guidance in this area. And now for our program. Tonight, we have 3 women who will be sharing their personal stories of infertility and/or pregnancy loss and the complicated relationship to mikvah that sometimes emerges in dealing with these challenges. Our first speaker, Dr. Aimee Baron, is the founder and executive director of I Was Supposed to Have a Baby, a nonprofit organization that utilizes social media to support Jewish individuals and families as they're struggling to have a child. It provides a warm and nurturing space for those going through infertility, pregnancy loss, infant loss, surrogacy, or adoption, in addition to connecting those families to resources in the Jewish community. Dr. Baron was formerly the Director of Innovation and Growth at Nechama Comfort, and she has worked as an attending pediatrician in the newborn nursery and the neonatal intensive care unit at St. Luke's Roosevelt Hospital. In addition to Dr. Baron's relevant professional knowledge, she'll be sharing her personal story with us. Aimee lives in the New York area, so we welcome her virtually to Silver Spring. Rebbetzin Rachie Reingold grew up in Silver Spring and is an alumnus of the Yeshiva of Greater Washington and Beis Yaakov Yerushalayim. Rachie has been in chinuch in New York, Cleveland, and Silver Spring for over 35 years. She currently teaches at the Yeshiva of Greater Washington and WITS, Maalot in Baltimore. She is married to Rabbi Eli Reingold, Rosh Kollel of Kollel Zichron Amram at the Yeshiva of Greater Washington. They are the proud parents of 2 children and a grandson. Rebbetzin Elisheva Levitt, a native of England, has been living in the United States for almost 23 years and in Silver Spring for over 2 years. She has been a teacher for 20 years and currently teaches first grade general studies at the Berman Hebrew Academy. Together with her husband, Rabbi Aaron Levitt, she also runs youth programs at the Kemp Mill Synagogue. Over the years, Elisheva has been sharing her fertility struggles and the emotional turmoil she and her husband experienced in their efforts to build a family with individuals and small groups. This is the largest group with whom she will be sharing her story. She and Rabbi Levitt have helped many couples dealing with similar challenges, especially surrogacy, and they have both also written about their experience. She's honored to have this important platform to share her story with all of you tonight. Finally, our moderator, Dr. Karen Wasserstein. Dr. Wasserstein is a psychologist who specializes in the field of fertility and family building. She works both in private practice in Bethesda, Maryland, and at Shady Grove Fertility in Virginia and in Maryland. Dr. Wasserstein provides counseling for individuals and couples, as well as consultations for those using third-party reproduction. Dr. Wasserstein works with various Jewish organizations in her capacity as a fertility psychologist, a consultant, and a teacher to help clergy and other Jewish leaders understand the psychological and communal aspects of fertility treatment. Dr. Wasserstein was raised in Teaneck, New Jersey, and has lived in Kemp Mill and Silver Spring for the past 22 years. Karen, please start us off.
Thank you so much for that introduction. The CDC, I think we've all heard of the CDC, defines infertility as the inability to conceive after 1 year while not using any form of birth control. About 12% of women between the ages of 15 to 44 in the United States have difficulty getting pregnant or carrying a pregnancy to term. People can find themselves on a fertility journey who have difficulty conceiving or carrying a child. There are those who are diagnosed with female factors, those diagnosed with male factors, those who have both, and those for whom no etiology or diagnosis can be found, otherwise known as idiopathic infertility. Some people have primary infertility, difficulty having a first child, and others undergo secondary infertility, difficulty having a subsequent child. There are those with fertility issues post-medical situations such as cancer, those who undergo treatment due to carrying particular genetic conditions, and those who experience recurrent pregnancy loss. Tonight, we will hear the personal stories of 3 couples, but they represent the many, many stories, each different from the other, of people in our community who have gone through their own journeys. All 3 women speaking tonight came here in order to shed light on something that is often dealt with in the dark. We as a community are incredible at the scripts that our religious life provide. When someone passes away, we all know what to do. There is a well-orchestrated script that includes people coming into our homes to get a Shiva house ready, announcements to tell people when and where to provide comfort to the mourner. We stand when they walk into tefillah on Friday night, and we even know our lines when we leave a Shiva home. But to be honest, we're not so great when there is no script. For those who have a miscarriage, there is a loss. For those who go month after month not becoming pregnant, there is a loss. For those who go through treatment after treatment with doctors giving percentages that contain hope, but they live in the other percentage, that of grief, there is loss. And we as their community may or may not know what is happening. And we generally do not know what to do or what to say, even if we do know what is happening. We do not know how to give comfort for someone in unscripted loss. And we do not know how to cope with our own or our friends' lack of control to fix anything. There is also hope and joy, as you will hear from our 3 panelists. And we need some guidance how to respond to all of it, the grief and the joy, as will be discussed here tonight. This panel is being brought to you by the Mikvah Emunah Society. Mikvah is a key component in our cyclical Jewish life, and it bears witness to our most personal experiences, both of growth and of despair, of hope and of challenge. I thank the Mikvah Muna Society for hosting this panel to help our community understand an issue that is not often seen. Privacy and support are often inversely related. When we have a very high privacy wall, we do not get any support. The goal, as I often tell my clients, is to lower the privacy wall enough to get the support we need in our individual circumstances for what is right at the time. Mikvah is a perfect example of balancing privacy and support. Mikvah is a very personal experience, and yet there is an attendant there to assist. We thank these 3 women for coming forward as representatives of the many, many people in our community who have had their own stories so that we can learn from them and better support and be sensitive to all while also respecting privacy. For the past 10 months, since the beginning of COVID-19, I seem to be on a lot of video therapy sessions. They almost all start the same. Wait, I think you're there, but I can't hear you. Okay, I can hear you, but I can't see you. Okay, I see you and I can hear you. Can you see me? Can you hear me? But isn't that truly what all of us want in general? Can people see us? Can people hear us? Thank you all for coming to see and hear our 3 panelists and to hopefully be better able to hear and see each person in our community, regardless of their story. Before we begin, I just want to define some common treatments that you'll hear tonight. IUI is intrauterine insemination. This is when the sperm is collected separately and inseminated directly into the woman's body as a targeted insemination. This can be done unmedicated or medicated, which would mean the woman takes medications to get more than 1 egg ready at a time to increase the chances of pregnancy. IVF is in vitro fertilization. This begins with an egg retrieval. The woman uses medication, oral and injectables, to help her mature numerous eggs and prepare for the retrieval. Her husband also does a sperm collection. The sperm and egg are then joined and embryos are created in the lab. Sometimes these embryos are then tested for chromosomal and/or genetic issues. The woman will then undergo an embryo transfer, either a fresh transfer of an embryo that was just fertilized and grown in the lab, or a frozen embryo, an embryo that had been previously frozen. Gestational carriers are women who carry embryos with someone else's sperm and eggs. The couple creates embryos through IVF, either with their own gametes or with donated sperm and/or eggs, and then the carrier carries the pregnancy. According to guidelines, the carriers have to have had a child of their own before they are eligible to carry for someone else, both for medical and psychological reasons. I want to give a brief outline of today's program. Each of our 3 panelists will be asked to share their personal stories. We will then have a panel discussion with guided questions, and at the end, a Q&A from questions you send in. Please feel free to send questions to the Mikvah Muna Society representative on the chat. I think it says Mikvah Q&A. The program will conclude at approximately 9:30. As Renee said, the panelists have all agreed they would be available if anyone would like to contact them, as am I, and our contact information will be provided at the end of the evening. Aimee, can you start us off by sharing your story?
Sure. Hi, everybody. Thank you so much for the warm welcome, for this incredible program, bringing so many different women together to really learn about fertility and learn about the challenges that one faces when they might be struggling to have a child. It's so interesting. I've been doing this work for 5 years already, and every time I have to get up and tell my story, I still get that like little flutter in my chest because it's deeply personal. And also I've been through a deep and really intense amount of pain in my fertility journey. So you'll excuse me if I get a little emotional at times. And I know as we prepared for this event, I imagine the other women will get emotional at different points as well. So I'm just warning you. So for me, I was lucky enough, I'm a pediatrician by training, and I went through medical school and finally met my husband right in the beginning of residency. And we decided to try right away. And thankfully, we had our daughter a year after I got married. And then at that point, we kind of just said, okay, like, let's just chill out for a moment. We actually got dispensation from our Rav to take a little bit of a break, being that I was working 90 hours a week and could barely keep my eyes open, let alone take care of a newborn and my patients. But then after a year, we started trying again, and I couldn't get pregnant. I just couldn't get pregnant. We tried and tried and tried and tried, couldn't get pregnant. Ended up seeing a fertility doctor. They tested myself, they tested my husband, and neither one of us had any issues. They called it unexplained. And so they said, okay, so here's some Clomid and let's try an IUI, Clomid being the medication that's given to women to induce ovulation. Let's try to get your ovulation sort of, amped up. And let's do the IUI, as Dr. Wasserman was talking about before, the intrauterine insemination, to try to bring things together faster and help it to come along. And that worked. The first round we did that, it worked. And I was elated thinking, okay, we've got this solved. And we got to the first ultrasound. Everything was fine. Second ultrasound at 8 weeks, the doctor's joking with me and there's no heartbeat. So that spiraled into I thought we had this covered. Now I'm dealing with a miscarriage. What does this mean? What's the story with the baby? It ended up that baby, that pregnancy was what was called a blighted ovum, meaning that it never actually developed into a full-on embryo, that it never developed a heartbeat. It only had what they call is a fetal pole. And it ended up that when we did genetic testing on that baby, it was a trisomy, which meant that it had 3 copies of the chromosome, of a specific chromosome, which was not compatible with life. So while that obviously made me feel better in the sense that I knew that at least my body was functioning and I could get pregnant, but that for whatever reason, it made me feel worse. I shouldn't say whatever reason it made me feel worse, but it still made me feel worse that we were so elated to be pregnant and now had to start all over again, as if, we were back to square one. We went through another round of Clomid and IUI. It didn't take. Then we switched doctors, started doing injectables, sort of more heavy duty medicines with IUIs. That didn't work either. And then the next cycle, some of these medications can inadvertently induce a cyst in your ovaries. So those medications did for me, and I was prohibited from trying the injectables again that next cycle. So the doctor said, look, let's just try a natural cycle. We know that you ovulate on your own. So let's try a natural cycle. You'll have sex normally. I'm allowed to say that, right? You'll have sex normally with your husband, but we'll also do an IUI and sort of let's just kind of see. And then we had my son 9 months later. So whether it was because of the IUI or not, I don't think any of us will ever know, but we had our son. And from that point forward, getting pregnant, not my problem anymore. It seems that whatever the issues were that inexplicably came, inexplicably left. So I'm the kind of person that generally nurses for a year. I don't get my period. During that time, I stop nursing and then I get a period. And so I stopped nursing my son after a year. And basically after one cycle, got pregnant again. We had my daughter 9 months later, 3 children, thank God. And look, I live in Riverdale, we're a modern Orthodox community. The thought was, I'm not interested in having 12 children, but 3 wasn't really the point that we wanted to stop. We always thought the ideal family for us would be 4, 5, or 6. So again, I nursed her for a year, stopped, got pregnant, and thought, okay, here we are. Here's the next pregnancy. And I made it. And each time that I was pregnant again, meaning with my son and with my daughter, that 8-week appointment, when I had previously found out that I had no heartbeat, were gut-wrenching, anxiety-producing appointments. Like I would walk in and be like, oh, what's the doctor going to tell me? And thank God everything was always okay. And so, you know, it was all good. And I assumed a pregnancy then, you know, once you have a heartbeat, everything is fine. So again, with this pregnancy, now mind you, this is the pregnancy after my daughter. So 3 children at home, next pregnancy, got to the 8-week appointment, heartbeat, everything's good. And we, you know, just go on. And I come into the 16-week appointment and the nurse can't find the heartbeat on the Doppler. And I'm like, okay, whatever. Maybe she's like not trained very well. I'm a physician. I'm a little bit, you know, I'm like, let's go, you know, get the real ultrasound machine. And the doctor came in to the ultrasound machine with the ultrasound machine, and there was no heartbeat. So I had a 16-week pregnancy, which was totally fine at 8 weeks, and yet inexplicably stopped growing, and I had no heartbeat at 16 weeks. And nobody could give me any answers. That was a perfectly healthy pregnancy. That was a girl, normal genetics. I don't have any medical problems. And my doctor basically threw up his hands and said, I don't know, it's a fluke, it happens. Like, you know, you're young and you have 3 kids. I'm sure everything will be fine. Like, just try again. So, I mean, I'm not, the point of this is to tell you the story, not to tell you about the months of deep depression afterwards, but we'll get to that. So we went home and tried again after I kind of got myself out of bed again and decided to face the world. And again, got pregnant very quickly. And again, at now 17 weeks, I walked in and no heartbeat. Again, perfectly healthy baby. This time it was a boy, and nobody had any answers. And that exact scenario happened 2 more times in the span of 3.5 years total. So from the time that I lost that first pregnancy to the time that I lost that 4th pregnancy, 4 second trimester losses in a row, it was about 3.5 years. We traveled the United States trying to get answers. I'm a physician, I'm a science person. I need answers. I was desperate for answers. It felt like when you lose a pregnancy exactly at the same time with healthy babies and a healthy mother, it felt like there had to be an answer. And there really weren't any. And that was really the most frustrating piece out of all of it. And we basically got to this place where initially, you know, after that 4th loss, I turned to my husband and I said, yeah, I'm done. Like, I can't do this physically to my body anymore. I can't do this emotionally to myself. We have 3 other children. Like, how do we begin to even think about this anymore? Like, each time it took me longer and longer to crawl my way out of that depression and come back to myself. And some of my dear, dear friends are on this Zoom right now, and they know, they were there. And I just said, I can't do it anymore, and I'm done. And we took a number of years off. And I was getting older, and I finally at one point turned to my husband and I said, you know, we don't have answers. Science, medicine, no one can give us answers. But there were all those things that people said that you should try, even though they're not really based in science per se, or wasn't any research, like the, you know, stand on your head every second Tuesday and like eat only gluten-free. Gluten-free was not a fad back then. You know, bed rest, like all these different things, acupuncture, which does actually have some data behind it. But there were a number of different things that people sort of threw at me and said, why don't you try this? Why don't you try that? Why don't you try this? And I just said to my husband, I said, you know what? I am not going to feel psychologically whole with this until I know that we have done all of our hishtadlus, like everything that anyone had possibly ever mentioned to us that might be helpful, forgetting about like the ruchnius of the like davening at all of these different kivarim and getting brachos and wearing rubies and like doing 1,000 things that like people had suggested over time from that perspective as well. But I just felt like I'm a science person. Like I know there's no data, but I'm not going to be able to live with myself until I know that we've tried everything. Will I be okay if my lot in life is only 3 children? Absolutely. But I need to know that I've done this. And so we did. We tried one more time. We threw the kitchen sink at this pregnancy. I got pregnant. Again, getting pregnant, not my problem anymore. And at that point, I was older and I dropped 2 eggs. And so there were 2. And I honestly, until the moment they were delivered, I never thought I was going to hold them in my arms. I was sure that they were going to die, just like all of my other pregnancies. And I have twins who are 7, and they're here, and now I'm going to cry. And they're here, and they're delicious, and they're healthy, and they're my miracles. And we don't know why. Medically, nobody has a clue as to why that pregnancy worked and the others didn't. So I'm here for all of you. Look, I spent 2 years taking care of my twins, and then I was asked to speak locally. I live in Riverdale. I was asked to speak locally to my own shul about my experiences. And at that time, it was 5 years ago, where people were just starting to talk about infertility and loss in the Jewish community at large. And I felt comfortable doing so, much more nervous than I was then than I am now, but I felt comfortable because my story wasn't a secret. I had 4 second trimester losses. People knew I was pregnant, and then I wasn't pregnant. So it wasn't a secret. And so I got up in front of 150 women on a Shabbos afternoon, and I told my story. And then that sort of spurred my real desire professionally to do this work and to help. And we can talk more about that later, but this is my story.
Thank you so much, Aimee. And we really appreciate you coming all the way here tonight to share your story.
Into a bedroom.
Rachie, can you please share your story?
Okay, there we go. Now you can hear me? Okay, thank you. Thank you, Karen. Thank you to the Emunah and Mikvah Society for hosting this and giving us all a chance to talk about a really important topic. Okay, so my journey took 11 years and then plus. Just a little background, I grew up here in Silver Spring and went to Yeshiva, like you said, and I was married at the young age of 19. And I really anticipated having a large family, the 12 that Aimee just mentioned. I'm the youngest in my family, and my siblings all, Baruch Hashem, got married and had children right away. And every year or two, Baruch Hashem, added another to their family, and why not me? We lived in Cleveland in Kollel and Tells. And just to give you a little bit of the lay of the land there's one street called Tremaine Drive. And that's where the vast majority of the Kollel lives. So you can just picture that we have one street with about 10 garden apartments and 60 young families all there together. Baruch Hashem, in all various ages, but for the most part, having children quite frequently. So, you married, 1 month, 2 months, 3 months. And I know when we had this initial meeting, Karen asked what prompted you to start to worry, and I couldn't remember. Then it hit me as I was thinking about this. After a few months, I started to worry. I knew a little bit. I went to the doctor because I knew my timing was off in my cycles. I knew that probably Mikvah was not hitting the optimal time to get pregnant. So I went to the doctor who most of the frum women used, and I just laugh about it now because I sat down, 19-year-old, and maybe then I was 20 already, a little bit nervous, and I launched into this very detailed explanation of Taras HaMishpacha as if he didn't know because he was the doctor for like the entire community, but I don't know why I felt I needed to educate him. He was very patient. And I told him what was happening with me and why I thought I wasn't getting pregnant and etc. And he said, okay, not a problem. We can fix that. And he promptly wrote me a prescription for some progesterone. And woo, like magic, boom, it worked. Amazing. That was like, it's okay. This is it. This is the cure. So 1 cycle, 2 cycles, 3 cycles, and nothing, nothing, nothing. And at this point, an app started playing in the background or in the foreground. And this app repeated itself every single month. And even when I tell you about the times when I was strong or that, chizuk that I had or whatever it is, rest assured that this cyclical app just kept going. And that was a cycle of joy, anticipation, 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 crushing disappointment, a lot of tears, regrouping, and let's just say in Hebrew, chozer chalila, and it happens again. And again, and again. And after a few months of the progesterone, nothing. And then we went to Clomid, and still a few months later, still nothing. And my mother said, be patient, it's all good. My sister said, who might be on tonight, I don't know if you are there, Esther, thank you for coming if you are. Be patient, it'll be okay. And I'm patient, but Baruch Hashem, like I said, I'm living on Tremaine Drive, and there are simchas all around. Baruch Hashem, one after the next, after the next. There's probably a Shalom Zachar every other week or a Kiddush. And then we started, Baruch Hashem, people, notice we're married a year, 2 years, and we started getting offers to be kvater. And we took them. We took all of those offers to be kvater because of the school of kvater. And we also felt that even if it's uncomfortable, the tefillos of the people who are there, who are watching us, who hold us near and dear, is just worth our discomfort. And we did it. And we even took kvater when we weren't tahor. And that was a little bit awkward because it took a little bit more planning of the handoff, and we had to just make sure there was a little table or something there the first time we did it. So if you're kvater, and make sure there's not a puffy pillow because the handoff on the table was a little bit, whatever. It wasn't so easy. And Baruch Hashem, Rebbetzin Azban Elisheva was just nifter recently, kind of from the distance, noticed what was happening. And she just made a beeline to us and rescued the baby. Baruch Hashem, nothing bad happened. But we did it. We just felt that was really important to do and to have, everyone's tefillos. Besides my mother, Allah Shalom, and my sister, we had some friends, and we'll talk about more about, the balance there that helped us a lot, that we just, turned to. At that point, not yet the posek so much, but Rosh Yeshiva Rechaim Stein Zatzal was there to give us chizuk. He himself, his son, and daughter-in-law ultimately adopted a child. They were struggling with infertility. So besides being such a warm person himself, he really resonated with us. And he was very good at helping us not beat ourselves up, because you tend to introspect and say, okay, why is God punishing me? What does he want from me? And Reb Chaim Stein Zichrono Livracha was a huge Torah sage, Talmud Chacham, tzaddik, everything. And you could really depend on what he said. And when he said, quit beating yourselves up, for a little while, you quit beating yourselves up. And every time we went and we asked him, so what should we take on ourselves? What Kabbalah should we make? And he would just say another parak of Tillim. And we were like, we wanted something much more spectacular than that, but that's what he told us, another parak of Tillim. So that's what we did. And then we asked the question, how do you balance between, when you fall apart, your tefillos are really intense, but when you're falling apart, you're falling apart. So what's the balance there? Is it good to fall apart or is it not? So he said something, and I know this is part of my journey, so it's not a medical part of the story, but I think it is an important part of the story. And he said, what do you think? Avram Avinu and Sarah Imenu, their tefillos in general were beyond anything we can imagine. And Chazal tell us that Hashem made them childless because Hashem wanted their tefillah. So what did Hashem want? They were amazing daveners anyway, we can assume. But Hashem wanted a little more. So all he wants from you is a little more. And that was, okay. In the meantime, we're still like just trying these methods. And Baruch Hashem, I taught. I've been teaching for years, and that literally was my lifeline. Still keeps me alive today. And I really feel that anybody who is going through any nisayon needs to have something that they really love to do and something to keep them super busy. And teaching really did, I literally say it fulfilled part of my maternal instinct. When I went to BJJ, and I don't remember so much what the teacher said verbatim, but I do remember on the first day of school, Rebbetzin David, she should live and be well. She doesn't have children. And I can't believe what she said. And I'm sure none of us understood it then. I only understood it in retrospect. She said in Hebrew, Yoser mimasha rotzeh ha'ega linok, rotzeh ha'para lahanik, which means more than the calf wants to nurse, the cow wants to give. And she was obviously talking about herself. And I can't believe how forthcoming she was. But again, it went all over our heads. But that's how I felt. So at least I had my students, I had my teaching. It kept me very, very, very busy. In the meantime, testing, and we ultimately decided that we need to have a surgery, that there's adhesions there, and that's, we have posek very heavily involved. Our posek also didn't have children for 10 years, world-renowned posek, and that was good. That was important to us also, that he could really resonate with us. And went and had a surgery. They discovered a lot more there than we expected, but I'm not going to get into that. But they were optimistic that would correct it. Again, nothing. And that background app is now like ramped up. And then we went, at that time, married on 37 years, pardon the pun, but IVF was in its embryonic stages. So I was telling Karen, the women, that in high school, I remember that Time magazine cover of the test tube baby. So that was not too many years later, but Cleveland Clinic had a very, exceptional program. And we did it. And we went through the shots and we went through the ultrasound. Me, my husband, emotionally, but me physically, shots and injections and doing it yourself and ultrasounds and, every morning showing up there and being tested. And if you have a coworker who you kind of suspect this is happening and they're coming late every day to work and feeling really worn out, just buy them a cheese Danish and a Starbucks and leave it on their desk with a nice little card that you love them. Anyway, so this is going on, and we went the IVF cycle, and the retrieval was very successful, and I held a world record for the number of, of eggs retrieved, but again, nothing, that's it. And every time that app just ramped up. But my mother-in-law, Shalom, was a survivor and a fighter. And she never, ever gave in to sadness. Even her pictures after the war, maybe the first one was like a serious look, but after that, she just plowed forward. She always had her makeup on. She always had a huge smile. And she just trained us, I don't know if psychologically this is the right thing, but just to fake it till you make it, and just to plow forward and to cope as much as you can outwardly. And hopefully the insides will come. Yes, no, but they will. My favorite bracha, that time still is my favorite bracha in davening, is Shasali called Sarki, which means that I thank Hashem for giving me everything that I need. And I felt that was a very good present bracha. Yes, today I have everything that I need. Please Hashem, make tomorrow different. I thought that was a good balance between resolution, amuna, bitachon, and tefillah. And Baruch Hashem, I had my teaching, like I said, my husband had his chavrusos, his vadim. I had my nieces, my nephews, my neighbors' kids. And honestly, we went through a lot of surgeries, 4 surgeries. Nothing. And I, could probably read Gateway to Happiness by heart, and Ashrar B'Tochon I could quote by heart, and Emet from Miriam Adahan I could do by heart. It's my most worn book in my library, which I still love. And it helped me cope. I just coped, but no baby. And at that point, I was married 8 years, and we hit a brick wall. That was it. It was a brick wall, and we just knew that this, al pi derech hateva, this is not going to happen. And at that point, we looked into adoption. And we weren't the first. There were some neighbors of ours, 2 sets of neighbors that adopted children, and we went to them and then for chizuk, and so we had it was, we'll talk about this later. It was a change. It was a definite paradigm switch from being very private to being much more public. We'll talk about that. Home studies. No one has to have a home study before they have a baby, except maybe if you have a third party donor, you need some kind of psychological support there. But we'd home studies and everything else. And Baruch Hashem. So it took 3 years. We have a wonderful facilitator that helped us. And then something was happening. My sister actually called me and said, there's a baby that's going to be born and it's going to be yours. And don't worry about the money, which was significant. I won't tell you the details, but she said, this is how it's going to work. And just when the facilitator calls you, just say we're in. And we did. And Baruch Hashem, the Shabbos before Thanksgiving, 1994, our son Elazar was born. And we flew down to adopt him we flew down on Sunday. We adopted him on Monday. Baruch Hashem, the facilitator's wife, you're talking the week before Thanksgiving, was a travel agent, Hodul Hashem Ki Tov, because she got us tickets to fly back on Wednesday, Erev Thanksgiving, to Cleveland. Can you imagine? Last minute tickets like that. And that Shabbos was a bris. Month later, Pidyon Haben. And still, whatever, it's Baruch Hashem, the family came, and there was a lot of rejoicing and a lot of tears at that point. Between his birth and my daughter's birth, we moved to Silver Spring. And there's about a 5-year difference between them. And again, our facilitator helped us and my sister jumped in, same way. And Baruch Hashem, I have a 26-year-old son and a almost 21-year-old daughter. My son is married, has a baby. And that was the end of our journey. That was both the infertility and the adoption.
Thank you so much for sharing your story. Elisheva, can you share your story?
Yes, I'm a teeny bit nervous, so bear with me. Even though I public speak to 6-year-olds every day, apparently this is more nerve-wracking. So I'll try and keep it brief, although it's not a brief story. And these stories, no matter how long or how short they are, they always feel like a million years, right? We go through so many journeys that really affect us and hit us deeply, and therefore they always feel like a tremendous, tremendous journey to go through. I too, like Rachie, who has my new admiration because she's amazing, also married very young. My husband and I knew each other in high school. Long story. It's a good story, but for another time. And I see so many faces people who are at our wedding 23 years tonight. It's our anniversary. So it feels very appropriate actually to talk about this story tonight. There's nowhere to go anyway for anniversary. So we got married at 19, had our daughter Shira, thank God, a year later. Found out during the pregnancy that I may have some challenges going forward, but didn't really know till after she was born, 6-week checkup, that I had something called Rh negative blood, Rh disease, which meant that future babies that would be born potentially could be in danger because I'm negative blooded, my husband's positive. Positive dominates negative. I know nothing about science, but that I know. And therefore, likelihood of our babies being positive blooded was very high. And therefore, they would have to monitor me and be sort of high risk pregnancy. Great. A couple of years later, we were actually in Israel for the year. We decided it was time. We got pregnant. As Aimee says, getting pregnant wasn't my problem. Everything was normal. So a doctor regularly had what they call antibody titers checked to see if if I had antibodies, which is like what attacks the baby's blood when you're different blood types. Everything was normal. We came back to the States, went to sleepaway camp, it was Camp Mill Synagogue. We were driving back for ultrasounds, had an ultrasound at 32 weeks, went back to camp, which is like a 2.5-3 hour drive, got a phone call the next day that I did not have an ultrasound, I'm sorry, I had a checkup. Got a phone call the next day, my numbers are through the roof, my antibody levels come back. At that moment, in my head, I sort of knew something was wrong. In my heart, in my head, I was having a poking game with the baby all night, no response. And I was like, it's in your head, you're imagining it. Anyway, unfortunately, went straight to the hospital and found out that I had lost the baby at 32 weeks. Not lost the baby had died. what happens is that when the antibodies attack the baby becomes anemic. It's called high drops. And then when the baby gets super anemic, the baby just can't survive. I had to go through labor, which is a whole separate story in itself, and very, very difficult challenge of 2.5 days of labor in a hospital where every 2 hours you're hearing, congratulations, it's a boy, it's a girl, it's a boy, in the next room. I was very much alone at that time. We had just come back from Israel. We didn't really know anyone, and no one really knew that I'd been pregnant. It was a very, very lonely time for my husband and I. I was young, I was 21. The pain of watching my parents watch me, because they had had some stillborns of their own, was extremely challenging. Them coming to the hospital, I will never forget. The look on the face, sorry, mommy, if I'm making you cry, but the look on their faces was like, we've been here before, now it's our child, and this is not normal. Pulled ourselves together. We were young and together, and thank God, very together. It really sort of pushed us closer. And we said, all right, next time we're going to be prepared. We're going to be much, much better prepared. A few years later, got pregnant. I was a student in Stern College. We got pregnant again, found a specialist. Actually, we found a specialist first and got pregnant. Went to the specialist in New York, and everything was good. The titers had basically checked my antibody levels again continuously. And at 16 weeks, I went for an appointment for an ultrasound and found out that this baby too had died. This was, and of course I had just started wearing maternity clothes and was so mad at myself for doing that, because I just made that transition of like, all right, I'm ready for everyone to know, I'm gonna put on these clothes, I'm good. And then came home and I remember ripping off my maternity shirt thinking, I'm such an idiot. That's what I kept thinking, you're such an idiot, what did you do? Of course, that's just, you know, emotion speaking, but that's how I felt. I proceeded to have a DNC where they surgically removed the baby. And then we sort of took a step back and said, whoa, and we're sort of 25, 27 at that point, and we felt like we had experienced a world of life in a few years. So we started talking about surrogacy. We weren't ready to call off having children, we weren't. But we realized that it wasn't going to be a simple journey, and we had to really have an open mind. And surrogacy wasn't a big thing at that point, but it had started happening. And we said, okay, so we found actually a doctor who lives in New Jersey, who is a frum guy, who has smicha from YU, a brilliant, brilliant fertility doctor. And we went to see him and we said, here's the situation. We think we need to use a surrogate. I didn't think emotionally I could cope with another pregnancy. He said, okay, let's do it. And amazingly, how do you find, so halachically speaking, you have to, the psak that we got through our Rav and through Machon Pua in Israel, which is an amazing organization, which I'm happy to tell you about another time. If you're having any challenges, you should be in touch with them. They said a single Jewish woman is what you want. Now, raise your hand if you think single Jewish women are lining up to have other people's babies. They're not. What we did is, at the time, it was when Teaneck Shul's email lists had just started, and we said, great, let's use it. So our doctor anonymously posted, looking for a Jewish surrogate, single Jewish woman, someone who's had a baby before, et cetera, et cetera. He started interviewing some women who showed interest. We came very close to finding someone, and then she fell through for a medical issue. Just at that time, we were so transitioning into, we had just bought a house in New Jersey. I was teaching in Yeshiva in New Jersey. And then suddenly we got a position instead in Boca Raton, Florida, and we're moving to Boca Raton instead and renting out the house in New Jersey. And I'll explain why I'm bringing that up in a minute. So the Rav said to us, listen, you got to go down to Florida. You'll for sure meet someone who has some incredible story, used an amazing doctor, and I just don't want you to give up on the baby thing until you're really certain that there's no options left. We said, okay, we'll keep an open mind. Sure enough, as he predicted, we met a couple in Florida who had this miracle baby. They'd found an amazing doctor in California. We connected with him. We did some blood work that he had asked us to do. And he said, you know what, your problem is completely different than what you're saying. It's not Rh negative issues, something else. Let's test out this medication. We tested it out. He got the results he wanted. He said, you're clear to go. Get pregnant again. Now, Hashem was laughing at us because I did not get pregnant straight away. And I remember talking to my best friend, Michal, who's somewhere out there in the audience, and saying, I can't believe it. Now I can't get pregnant. She's like, just trust in Hashem, it will happen. And she was right. I just had to be patient. I was impatient. Got pregnant once again under the direction of my local doctor together with this doctor in California. We were seeing a regular perinatologist. I was getting ultrasounds very regularly. And then we, at 16 weeks, they do my blood work and they see that my numbers are starting to go up again. Danger zone, right? This is not sounding good. I call my doctor in California, and this is going to be a slightly shocking, but I said to him, Dr. So-and-so, what do we do? He's like, honestly, I don't know what to do with you. I'm at a loss. And I was like, no, I'm 16 weeks pregnant right now. What do you mean? He's like, I'm sorry. I just don't know what to tell you. You're going to have to get help elsewhere. So even if, as I say it now, I'm like mind boggled by whatever. He's passed away since, so he should rest in peace. Anyway, so my perinatologist, my doctor was very sympathetic. She's an amazing, incredible doctor. My perinatologist said, this is insane. It's nuts. I'm going to figure out what to do with you. Okay, she's not the doctor, she's the perinatologist, the ultrasound doctor. She calls every friend under the sun. Long and the short of it, they give me some this infusion medication they think that will distract my antibodies. And I wound up in hospital with meningitis because it was given to me wrong. But the pregnancy was still viable. And I pulled myself out of 2 weeks of crazy headache situation, went back to work. We were planning to go away for Pesach that year. And then last minute, the doctor's like, you know what, your numbers are still not fantastic. I don't want you going anywhere. Fine, we stay. Chalom and Pesach, they said, we need you to come in for an intrauterine blood transfusion. That means a blood transfusion to the baby in utero, which is an insane procedure. Had a room full of people watching. It was quite amazing to watch actually myself. It's like an amniocentesis, but they put a needle into the umbilical cord. It's crazy. It worked the first time. I was 22 weeks at that point. They said, you're going to have to come back for another one after Pesach, go back for another one 23 weeks, have another blood transfusion. And then I find out, unfortunately, that it hadn't worked and the baby had died, 23 weeks. Now, at this point, we had lived in Boca for a number of years and had already a building incredible support system, incredible friends, rabbis, Rebbetzin. I can't even describe how amazing our friends were and how I don't think I would have survived any of this, besides my husband, that's obvious, but like with these friends and family support. I had to be in juice labor again because the baby was too big to do a DNC. It was another day and a half labor, and there was some other crazy things that went on at the same time, other people in labor at the same time in the hospital as me, who I knew. It was very, very awkward, strange time. And I just distinctly remember the friends who came to visit. It's not easy to visit someone who's going through a stillbirth for days on end. And it's not easy to know what to say. And those friends somehow mustered up the courage. And I still think of them as such courageous women to come and visit and comfort me and say the right words and just be there for me, which was meaningful beyond measure. After that, I was a complete mess, as you can imagine. I was having panic attacks. I was having fights with my little 6-year-old Shira, which ironically, it only just occurred to me now after all these years. Her middle name is Nechama. And it was Nechama in memory of family friends who had died. But honestly, she really provided me Nechama after I lost that first one. It gave me a purpose and something to do. And I don't know why I didn't think of this till today, but thank you for helping me think of this amazing piece. Anyway, Shira was going through a tantrum stage, and I was going to my doctor and saying, I'm going to die. My heart is exploding. He put me on medication on Zoloft, which helped a tremendous amount. We call our Rav when things had calmed, and they said, we exhausted everything. I am not doing that again. And he said, right, let's do this. Let's find you a surrogate. Long and the short, we Googled surrogacy lawyer in Boca Raton. 2 names came up, picked the first one. She had a cool name. And I went to visit her. Not a big field yet, right? So we go to visit her. We explain our parameters. We explain the single Jewish woman piece. And we say, help us. She said, no problem. For a year, she advertised in a paper, looking, nothing. Just as we're about to give up and say, listen, we may have to switch to and use a non-Jew, which is okay. A non-Jew is okay. It has other complications. Like you have to convert the baby, and that adds layers of challenges, but it can be done. And honestly, sidebar, most people use non-Jewish surrogates because it's really close to impossible to find Jewish surrogates. But my lawyer called us Erev Pesach a year later and said, I had a dream about one of my surrogates who just had twins for someone else 2 weeks ago. And in the dream, she told me she's Jewish. I'm going to call her. She calls her and says, yep, it's true. I'm Jewish and I'm single. I do have a boyfriend, but we're not married. And I have a daughter and I just gave birth to twins and I'm willing to do it. Oh, and I'm 38, but I'm still willing to do it. She comes to me, us, Chol Hamoed Pesach, And I'm all embarrassed because what do you serve someone on Chol Hamoed Pesach? Nothing. I'm like, I'm sorry, it's just eggs and tuna. I apologize. But she says, you know what? I want to do it again. It was such an incredible experience. I really loved it. Let's do it. So it's a long process. There's a lot of psychological testing going on, and we get tested, she gets tested. There's medical testing. And then we have to learn about IVF, which is a whole new world for us. Luck has it, the IVF doctor that we used was a shul member in our shul, and my husband was assistant rabbi, which definitely helped the situation. And we went through IVF. Linda, our surrogate, who is a Lamed Vavnik, in my opinion, not religious at all, doesn't know anything about Judaism, although knows a bit more now that we're friends with her. She was the most, I can't even describe, the most calm, unbelievable person I've ever met. So the embryologist let my husband watch the embryos being put together and made, and and then there's all sorts of ways that you have to have these embryos watched to make sure there's no switcheroos and anything like that. Baruch Hashem, a million times, our amazing Linda got pregnant. We found out, Parshat Toldot, we found out it was twins, twins and twins. It was kind of cool. And then I forget which Parsha it was, but my husband's very into finding gematrias and Parshas connections. But we found out it was a boy and girl. We wanted to know just because, I don't know, we just wanted to know. This wasn't a normal circumstance. And she had, of course, a subchorionic bleed. She had a bleed in the middle, and I was panicking and freaking out. And she's like, don't worry, everything will be fine. And everything was fine. She was incredible. She called me, she said to me, do you want me to, she wasn't from kosher, nothing. She said, do you want me to give up pork? Like, I will if you want me to. I said, so I called the Rav. I'm like, should she? He's like, listen, if she's offering, absolutely. She's like, no problem. I'm on it. I'm good. She was amazing. Now, the reason I mentioned the house in New Jersey is because it happens to be right before this went down. We ended up selling that house for a profit, thank God. And the money that we made off of that, because we were both teachers, rabbi teacher, the money that we made off the house basically paid for this astronomical venture. If we hadn't had that house and hadn't bought it, even though we never lived in it, we would never had the money for this, we would have figured it out. But somehow Hashem helped us along the way. And we feel this with every step of it. Linda lived 25 minutes from our house. The fact that she was single and Jewish, and we had to prove that, that was a whole other story. She was amazing. Come June 12th, we go down to the hospital. We think she's in labor, 35 weeks, false alarm, go home. And next day she's like, this time it's for real. And I'm driving, but not route to the airport at that particular minute. And she calls me, she's like, you better come, it's time. And she was having a C-section. And it was 6/13, which is such a cool birthday. And my kids still love that their birthday is 6/13. I rushed, leave the airport, run home, grab Aaron. We had to drive like 45 minutes to go down, and we hadn't figured out names. And well, we knew Rena. We love Rena. It's a joyful name. It means happiness, right? And Shira's happiness. And boy, I really wanted Azaria. I thought Azaria, Hashem help. Aaron's like, on the way down, he's like, how about Simcha? I'm like, oh, wow, never thought of that one, but sure. Rena and Simcha, it just makes sense. Anyway, I will wind it down because the hour's late and we have lots to cover, but we, Baruch Hashem, gave birth to Rena and Simcha, which, okay, I'll give you a gematria. At 2:16 and 2:18, or I forget exactly the times, they add up to Teled, Taf Lamed Daled. Thank you, Aaron, love it. We were in the room, we watched our children. Well, actually, Aaron totally did not watch. He's the most Flemish person you'll ever meet, besides other issues of watching. I watched my children coming out of the womb. Literally, I have pictures. It was the most incredible experience, surreal, out-of-body experience. And Rena and Simcha were then ours at that particular, like that second. Linda's in her bed recovering. I'm on. They gave me a doctor's on-call room, which was weird. It was weird not to be in a hospital bed, like a normal delivery. I set my alarm every 3 hours. I went to feed those babies. I had incredible friends who slept and got lost on the way and spent 2 hours traveling to come see us. Shira was 8 and was elated. The Shalom Zacha, everyone was basket cases, as you can imagine. We were all crying a whole lot. The bris was amazing. Linda got up and spoke, which was such a brave, amazing thing to do. And all she kept saying was what a privilege she felt it was for her. Forget the opposite. She felt privileged that she had done this for us. We had them over many, many times. We decided we were going to stay in touch because we have such hakarat tov. We're so thankful to her that they came over again and again and again. Her husband now, they just got married, by the way. Her boyfriend at the time hates children, which made me feel much better. When she held Rena, she was kind of awkward with that, which made me feel better. I know it sounds funny, but it did. She did it lishma, as they say. She really did it because she wanted to help. P.S. We didn't tell our children for a very, very long time. We had a very big decision to make. When do we tell them? We knew that they will either hear it from us or from someone else. We pushed it off and pushed it off. We did decide we were going to be public about the story in general, because quite honestly, every time I've shared the story with someone who I felt like they might be struggling, will open up and tell me, actually, yes, I'm struggling. It's really been, that's been my therapy, honestly. We'll talk about that more later. But 11th birthday, I'm like, Erin, this is it. We got to do it. So I weave this gorgeous little story, this magical fairy tale to make it sound all very special, which it was. And I'm bracing myself for questions. What are my children going to ask me about this madness? Like, what are they going to say? My son happens to be very bright. I expected some amazing, crazy, intricate questions. And he's like, well, Aimee, I have one question. Oh, okay, hit me. Let's go. I can do this. He's like, why did you wait so long to tell us? That was his question. That was it. I'm like, you know what, Simcha? Such a good question. I really don't know. I should have told you sooner. You're absolutely right. Now you know. And then Rena, who's a few steps behind, she's like, oh, that's why we know Linda. Like, they never understood why we were friends with this random person from Fort Lauderdale. Anyway, and the final part is that Linda, who's incredible and calls us every year on their birthday and on Mother's Day and sends gifts and asks for pictures and is wonderful, came for Rena's bat mitzvah. So this was a big deal because Rena and Simcha were a bit nervous because they're meeting her in a completely different context. This is the woman who had us in her tummy for 9 months. This is so weird. And there was a little awkwardness at the beginning, but after that, the barriers came down and it was wonderful. And she would have come back for the bar mitzvah had COVID not been around. Anyway, I tell this story, and this is my final thought, and then I'll pass it on. I tell this story not for sympathy, not even for tears necessarily. It's taken me many years to talk about it without bursting into tears, to be honest. I tell it because I want to help people. I want people to know that it's okay to talk about these struggles. I want people to know that it's okay to think out of the box and do something different than the typical, than the norm. And people will judge and people will ask questions and people honestly will say really dumb things all along the way of your journey. But at the end of the day, you just have to remember that we're all human and we all need to be there to support each other. And without my family, my amazing parents, my in-laws, siblings-in-law, friends, I would never have survived any of this, honestly. The first time we lost, it was very, very hard. So if you haven't gone through the struggle, all I'll say is be the friend who's there. And we'll talk about what that looks like in a few minutes, but that is my nutshell story. If you want to hear more, after.
Thank you, Elisheva. And I'm going to take the liberty, since I'm the unmuted person of the almost 300 people on this call, to thank very sincerely all three of you for sharing your stories with us, for agreeing to be on this panel, for giving such a personal perspective to something that has so many facets, but each one of them is so important. There we go. As you heard each of the three panelists saying at some point, and then we're going to talk about this later, and then we're going to talk about this later, that is because we discussed the panel questions ahead of time. And so I'm going to do them a little bit in a different order just to make sure we triage them a little bit. So I'm giving you all a heads up, by the way. But let's see where we go. So can you talk about, I'm going to ask each of you this actually, can you talk about a time when something clicked in your head that you needed to do something different as a way to cope with all that was going on for you? Can you describe it for us? How did you know you needed to do something? And how did you decide what it was that would help you at that time? I'm going to go in the backwards order, actually. Elisheva, can you tell us a little bit?
So it's funny because until we had our pre-meeting, I hadn't thought of this, but one thing that I did when we were living in Florida was to establish a support group. After my loss, I discovered, people come out of the woodworks. When you share loss publicly, people will come to you and say, I also lost. And the stories that I heard afterwards were unbelievable. So I said, you know what, there's so many of us who've gone through this awful experience. Let's have a support group. And it was nothing formal, nothing fancy. It was different people's houses once a month. And we got together, we sat down and we talked about coping with loss. And it really, you know, I almost wish we still had it, but it really helped me just not feel alone. I think this is the biggest piece of these journeys, is the lonely feeling of going through something like this. So,
Aimee, can you answer the question too? Thank you, Alicia.
For me, it was the time that I knew that I needed to do something different was when I had already had those 2 second trimester losses, and then we're trying to figure out what the next steps were. And for me, that sort of stark line in the sand was, you know, yes, of course, I need to start doing the investigation and going, you know, traveling the United States and meeting with different experts and trying to get answers. But frankly, I was also really traumatized by the entire experience. And I had been seeing my regular OBGYN. And at that point, I just said, enough, like, I cannot be with you anymore. I need to actually go to a specialist. And then, so I went to see a specialist at Columbia who guided me through, unsuccessfully, but still guided me through the second of those 2 pregnancies, the third and the fourth losses. And then again, as we took that break, which I had mentioned to everyone before, after the break, when we reevaluated, you know, for the second time, okay, we're going to do one last thing, try one more time. Again, I felt I needed to switch doctors again. I couldn't walk back into that doctor's office at Columbia without like having a panic attack. So she was a wonderful doctor. She is a wonderful doctor, continues to be a wonderful doctor, but she couldn't be my doctor anymore. So I had to switch again. So that for me was, those are the places where I needed to make a change.
Rachie, can you share with us? With you're muted. See if I can unmute you.
Got you.
Got it?
Okay.
Okay.
Yes. Okay. So, you know, I think I mentioned earlier, like coping was really, really important to me, and being a friend and being social was also really important to me. And I lived on Tremaine Drive, where that was challenging because Baruch Hashem, there was so many kids and so many simchas and so much going on. And particular Shabbos afternoon was really challenging. It was hard because, you know, you go outside and the Baruch Hashem is all in your face. And staying inside, really being a little reclusive, which is where maybe I wanted to be, I knew wasn't really where I should be or want to be. So I'm a teacher, and I solved the problem because I knew I needed to force myself out and also provide a framework for conversation, for talking, for something that's not diaper oriented. So I started in the summer. I did it probably 8 seasons. We did Pirkei Avos on the green. And I started an outdoor shiur during the summer months. And I said this year, and it was little short, it wasn't long, you know, like I do now, long, convoluted, you know, machshavos. It was short little snippets. So if you have to chase your kid down the street, you can come back and still be part of the shiur. So it forced me out, and it forced me to socialize. And it also provided a framework of conversation that whole Shabbos afternoon that was something that was more comfortable for me. So.
Thank you. As I mentioned in my introduction, you know, this question between privacy and support is one I think we all struggle with, particularly in a very supportive, but maybe not as quite as private a community in community living. Can you share a bit how each of you navigated this? Were you able to share with others what was going on for you? How did you decide to share, and what was your experience of support? Aimee, can you start us off?
Sure. Look, in the beginning, when I was talking about my my first trimester loss, and when we were going through infertility, nobody knew. Our parents didn't know. Nobody knew that we had the loss until actually a few days after the loss, when I had the DNC and then ended up back in the hospital with medical complications. And then that was kind of when we had to call the reinforcements in. I had a 2-year-old at home and I couldn't take care of her. But everything sort of leading up to that, that we were having difficulty conceiving, that we got pregnant through intervention. I mean, none of that was discussed with anyone. Then what I would say is that after that point, you know, we sort of came clean with our parents and told them what was going on. And then they knew the rest of the story sort of to get to my son. And then afterwards, you know, as I was saying in the introduction, I had all of these second trimester losses. You know, when you have a second trimester loss, you don't have the luxury of keeping that private. It's already out there in the community. So especially that first loss where we were super excited, you know, we are typically people who share pregnancy news after the first trimester. So this was 4 weeks, 3-4 weeks after the first trimester. Everybody knew we were pregnant. And then everybody had to be told that I was not pregnant. So for that second pregnancy, the same, like we didn't tell as many people, but we told a few people. And then they had to all be untold. And actually that pregnancy I lost over Pesach while we were away. It was a horrific story. The third and fourth pregnancies, I didn't tell a single soul that I was pregnant. And so therefore, when I lost them, it was just this incredible amount of grief. And, you know, I had to share with people, oh, I was pregnant, and oh, I'm not pregnant anymore, just like the others. But I felt that I needed to protect myself emotionally at that point. I was having enough trouble connecting with the pregnancy for me. So therefore, it was even more difficult to try to share anything about that pregnancy with others. So we chose not to. And the same with the twins. We never told a soul that I was pregnant with the twins. Even my children, we didn't tell. It was only as like my stomach was getting bigger. And at one point, my son, who was, I don't know, 8 or so at the time, I'm not remembering his exact age. At one point, he like pats me on the stomach. I must have been like, I was just past that mark. I was like 18 weeks or something like that. And he's like, what's going on in there? Did you like eat a lot or something? And I'm like, yeah, I just had a really big dinner. And like at that point, my husband and I were like, okay, we need to start telling them. So we told very few people. We did not tell even our parents that there were 2 babies. Because again, as I said, I wasn't sure that those babies were going to live. And so why bring that extra heartache into the picture?
Elisheva?
Well, part of my personal problem is that I have a very hard time keeping things to myself. Not that I share secrets, God forbid, but I just like to talk. And talking for me over the years has really been a form of therapy. Honestly, I didn't get formal therapy, which I probably should have, but it was my form of therapy. And therefore, being open about the struggles that we were having, you know, I think that the pregnancies, the first 2 pregnancies, certainly we did share, of course, with our family, and they knew the risks involved and they knew the challenges I was going to have, and our siblings. But we were sort of in transit. We were in a weird place in our life where we were sort of young and doing the Washington Heights life thing, and then figuring out where real life was going to start. Once we went down to Florida and we sort of lived in a real community, not that Washington Heights is not, but the YU side is less so. We really felt, and Aaron also was an assistant rabbi, we felt like we did have to be open about it. We didn't want to wake up one day and just say, surprise, babies. It would have been so strange. So we were open about it. We were open, you know, I see my amazing assistant teacher who I worked with for 8 years, Hannah, who's on the call. She was my rock through the whole thing. She you know, I got a phone call from Linda that she was having this bleed in the middle of class, and Hannah's like, it's going to be okay, don't worry. You know, she was there. Hannah, I love you. You know, everyone supported me in such different ways, and those who didn't know what to say just stayed away, and that was okay. I was okay with that. We felt we had to be open, and of course, after the story, I knew I did not envision my family this way on any level. I did not think 3 children. I did not, I didn't think Hashem was going to be so specific about how this family was going to pan out. But I knew that there was reasons for this journey, and I knew there was reasons why we had to go through this. And for me, the very pushing piece of it was, Elisheva, you got to talk about it, because there's going to be people out there who are going to need to hear your story and to be told that it's okay that they need to do it as well. And I've spoken to so many couples over the last many years about surrogacy. I can't even remember how many at this point. And I've met people with coincidence. I've happened to meet people and they say, by the way, I think we were meant to meet. I need to talk to you about surrogacy. So being open for me in a very different story was critical. It was a lifeline for me, actually.
Okay. All right. So there is a balance between the privacy and the sharing and the support that you need. I'm going to take a little bit of a different take than Elisheva and Aimee did. I had to kind of figure out who I wanted to share with, besides my mother, my sister, a couple of very close friends, selectively. And I think I'm going to share some of the criterion, and I think that might just help the general audience at large. And there's a bit of trial and error, but I definitely needed somebody who was going to be congruent to my emotions. I couldn't share with somebody, if I share with someone and they went over the top beyond my emotions, that was an X. I couldn't do that. I couldn't have to deal putting somebody else back together again, or, I just needed them to be congruent with me, be on the same page with me, even if they were faking. That was what I needed. The other really important factor was I needed someone who was not going to follow up with me. I needed to be in control of that privacy. And if it was someone who's going to come back to me and say, well, how did it go? How was it? How are you doing? That was not going to be the person I was going to use either. And I can even picture some of, at least one person. I personally am to a fault. When somebody comes to me for advice in, any private matter, I said, I love you very much. And I'm really interested in what's happening. But you just have to know that I am never going to initiate that conversation. And it's not because I don't care about you. It's not because I'm not thinking about you. If you want to share with me, you're going to have to come back and tell me. Those are two biggies. Now, going to adoption was like 180 pivot, because we're so so private about our fertility treatments, kind of like Elisheva was saying, when it comes to adoption or, the surrogacy in her case, you got to advertise and people have to know. And that's how it happens. You think you just, it's not so easy these days. It's the amount of, it's really not easy. And a lot of it is telling people that you're adapting, telling people that you're looking to adapt, and it was such a 180 for us, because we are in general private people and our whole situation was private. And a lot of people just hear, the hairdresser hears from the person and in her chair, that someone has a situation, and okay, that's not how it happened, but it is how it happens. And that's how you're supposed to approach it. So that was a big paradigm shift. Once Baruch Hashem, our children were born, we kind of shifted back. Not that Baruch Hashem, everyone knows they're adopted, and they know they're adopted. That's a whole, like I said, different sugya from, from a year or two old, they knew they're adopted. But where the detail, my husband and I both felt strongly that their particulars, the details of their, birth parents, etc., is their private business. So when we brought Elazar home, either my sister or my next door neighbor Sima brought us a big bouquet of balloons, and B'hashgacha, one of the balloons had a whole poem about sent by God, the baby sent by God. And somebody went and asked, oh, so tell me the story. Where did he come from? I said, well, it's right here on this balloon, and that kind of ended that situation. And, if anybody wants to know, it's really my kids' business. But in, the general broad strokes of adoption, or, how or when or where, I'm more than happy to share with anybody.
Thank you. This is a mikvah event, so it feels like this is a good question that we should be asking. It's especially important to point out that for many undergoing fertility issues, mikvah can be a poignant or sensitive area. Can you talk about your sense of and your experience of mikvah during those times? Is there anything you wish a mikvah attendant would know, to do, or to say to show sensitivity? Who wants to go first? Rachie, go ahead.
I want to roll anyway. Okay, so I guess going backwards, I don't have an answer on that one. I think the mikveh attendants that I've encountered have been wonderful. I personally found mikveh to be, in general, to be a very uplifting experience. Obviously, the anticipation of reuniting, the anticipation of another chance, which I always just optimistic that maybe this time it's going to work. I look forward to it. And I'm not an anxious person, and I just personally felt that the hachanas, the preparations for mikvah, was like HaKadosh Baruch Hu imposing spa time on us, which is something just needed so much. Hashem just saying, okay, Rachie, get into that tub and soak in that, relax, do it. And I always found it to be a very positive, very rejuvenating experience. And Baruch Hashem, the mikvah women have all been wonderful.
I really like the fact that I made the teacher raise her hand. So Elisheva, can you share with us a little about this one too?
It's so interesting because I different experience in terms of not that sort of month by month waiting, which is so agonizing. We had a different kind of waiting, but not that specific kind. For me, I think no good deed goes unpunished. For whatever reason, after the two later losses, the stillborns, I had an incredibly long bleed afterwards for 2-3 months, which is really such a punishment, honestly, because you've been through so much and it's sort of like rubbing salt into the wound. So for me, when I finally, and I mean it, finally was able to go to mikvah and get a hug for my husband, which, I think he would have given me a hug if I needed it anyway. I think that it was such a unusual situation and so painful and so difficult, but we did the right thing. We did what we felt it was important to do. So when I could finally have that hug and cry together, like really cry together, it was like nothing I can describe. And so for me, it was like almost like this gate of recovery sort of just opening at that point where we could actually recover and mourn really together. It felt right after birth when you're bleeding, and it felt like it made sense because you feel so disgusting anyway, emotionally and physically. I didn't care at that point, but after 3 months of bleeding, and I'm like, okay, it's time, it's enough. That was a tremendous sort of a big weight lifted off. Just, I love hugs. I mean, hugs, who doesn't love hugs? So that's my experience.
Thank you. Aimee.
Okay, I'm going to be the lone dissenter here. I absolutely hated going to the mikvah every single month during all of my difficulties. I hated it, hated it, hated it, hated it. I resented the fact that I was back there again. I was supposed to be pregnant, whether it was when I was going through my years of infertility, where I felt like, why is this happening? I thought everything's okay. The unexplained infertility, like, why isn't this working? And here I'm back here again and again and again. And then the miscarriage, and then dealing with the aftermath and trying to get pregnant again. But even more so during the years when I kept losing all of those babies, I could barely get myself to go to the mikvah. I resented like the way my body looked, that I was carrying this extra weight from this pregnancy. I resented having to be there and felt like I was just back at square one, like my body was supposed to be holding this. Like, I resented every moment of it. Yes, of course, it was beautiful to be with my husband, but it just brought all of the emotions back again. And the mikvah experience for me was horrible. Look, the things that helped, and I would suggest also for any of you who are struggling, whether you enjoy the mikvah experience or whether you don't enjoy the mikvah experience, I took that time to daven, to pray while I was in the waters. It's said to be a special holy time to be able to pray. I asked for extra time from the mikvah attendant every time I go, and every time I went. And frankly, even to this day, we are very much finished for years already having children. But now I daven for my marriage. I daven for the community which I serve and all the other people struggling. So I still take time in the water and I still daven for everyone. But also, like, if you are feeling just uneasy about going to the mikvah, you can call the mikvah attendant beforehand and you can say, like, listen, can I have the last appointment, or maybe can I have the first appointment? We're not talking about COVID. Like, obviously things are a little bit different right now in terms of scheduling, but maybe when you're there, you don't want to see people. You don't want the mikvah attendant to talk to you because you just, like, the minute someone says maybe even hello, like, it'll just bring on this like deluge of like tears. Like, maybe you just really want to be left on your own. So just explain that to the mikvah attendant or the director at the mikvah. That's what they're there for. They're there to be sensitive and to be really caring for you during this time. So, like, my experience was very, like, it was horrible. I hated going to the mikvah, but just because that was my experience, it doesn't mean that everyone going through fertility is going to feel that way, as you see by, Rachie and Elisheva. So those are just my thoughts.
Thank you. That is why we have a panel of 3 people, because everyone's story is different, and it's really important to understand that. And I think mikvah attendants do understand that and are trained these days to understand, to try to fit each person's experience. What types of comments helped you, were supportive, and what types of comments were not supportive? A couple people have also written into the chat questions like this: how do you talk to people? What should people say, not say? Let's try to cover some of that and leave people with a few helpful insights from your own experiences. Aimee, can you start us off with that one?
Sure. I'll give some tidbits and everybody will also, but I know that Renee has a list that I prepared to be emailed for all of you afterwards that has a list of, things to do, things not to do, things to say, not to say, that all of you will get. So we're going to hit some of them now, but you'll have that for you as a resource for all of you later. Look, I think really one of the few most important things for me personally was a lot of what I think it was Rachie. I think you said it before, where you said, you wanted people to be there, and you wanted I wanted people to be there, and I wanted people to be respectful yet of my privacy. So, ask me, like, how are you doing today? Ask me, is there anything that I can do for you? I'm going to the grocery store. Do you want me to take your kids for a play date so you can have time to rest? I happen to cook some extra, soup. I'm going to bring it over. Like, all these like practical things. When anyone who's struggling with anything, it doesn't matter whether it's fertility or not, like, people just want to be thought of and they want to be comforted. And so the actual details and the things don't matter. It's really more of the gesture of, hey, I'm thinking about you because I know you're going through a rough time, and I want you to know that I'm here for you and ready to listen. That's really what anybody wants. And so I also, like, very much get these questions like, what should I bring? Like, how do I know? Should I bring this, or should I bring this? I'm like, it actually doesn't matter. You're bringing yourself. And that's the most important thing.
Elisheva.
Interestingly, I had to do a lot of reminding myself throughout my experiences that people always mean well, because people, often would say silly things or insensitive things, sometimes really silly things. And I had to remind myself, they're trying their best. They're human, and they're trying to talk in an awkward situation. To be honest, though, I'd rather than someone said something silly, not insensitive, that's different, but I'd rather someone say something silly than not say anything. I found that when people didn't reach out, it pained me. Like, it was painful because I felt like they didn't care. Like, do they not care? I just went through this crazy trauma, and many times, And do they not care to say something? Now, what to say? I shared this with you guys when we were planning. I remember in high school, I'll say as brief as I can, but in high school, I remember a friend of mine lost her father. It was the first time I'd experienced a close friend sitting Shiva. I remember going to the Shiva and saying, oh my gosh, please let me not have to say anything to her. Please, I'm so scared. What do I say? What do I say? I'm 16, I'm an immature baby. So I go and I felt such relief because there was so many people there. It was a tragic Shiva that I didn't get near her. And I was like, oh, thank God I didn't have to say anything. It's so awkward. Now, fast forward, not so many years, but fast forward a bunch of years, I realized, Elisheva, like, you have to say something. How can you not go to a Shiva? How can you not say something to someone who's gone through something tough? But it doesn't have to be elaborate, exactly like Aimee said. It doesn't have to be, oh my God, I can't believe it. What can I do? Tell me about it. All it needs to be is, I'm here for you. I'm here if you need. I love you. I'm here for hugs if you ever need. Please God, COVID should be over soon so we can do that again. I'm here to listen. I'm here if you need to cry. Cry to me, and it's just, it's not saying 500 things. It's saying, I'm here for you. That's the bottom line. And I think that, people who did that, whether it was my siblings or whether it was, texting, there wasn't such texting at the time. So now with text messages, it's there's no excuses. I mean, it's so easy. I would even use a voice message so they can hear your voice and say, I love you. I'm thinking of you. What can I do? If there's something I can do, I always say, you don't need to respond, but I'm here when you need me. And it works a charm. I do remember one other thing though. I remember one of my mom's very, very close friends, when we were living in Florida, she sent, I guess with my mom, when she came to visit me after my third stillborn, she sent a bag of like pamper yourself things like soaps and lotions. And I was so touched by it because I think she understood, you've been through trauma, you need to take care of yourself. And I value that. And I'm not saying everyone should start running to buy soaps for everyone, but just the fact that she made the effort, she went. And one other thing I do want to say, and we haven't really touched upon it, and I know the hour's late, and we won't be insulted if anyone needs to leave, it's okay. But I will say that the missing piece in the story is the spouse. I don't know if we have time to bring it up, but I think that we do need to be cognizant and keep in mind that our spouses suffer just as much, if not even more than we do, because they feel so helpless. My husband felt so helpless. He couldn't take the pain away. He couldn't take the angst away. He couldn't take the pregnancy trauma away. And he felt very alone. And guys, as much as women are not great always at knowing what to say, men are even worse. He remembers distinctly being in shul, and a guy comes over, and it was an Israeli guy, shaliach actually, and he came over from behind Aaron, put his arms around him, didn't say a word. He just gave him a bear hug. And Aaron, to this day, hasn't forgotten, like he's not in touch with the guy anymore, but he does remember how that felt. That action of, I know you're just as much in pain as your wife is. And so we do have to keep that in mind, and keep in mind that it's a trauma, for a double trauma.
I was going to get there, but I'm glad you jumped in there and said that. I think it's really important. When I talk to couples, I always talk about how there are three entities in a marriage. There's a husband, there's a wife, and there's a marriage. And all three of them really need to be tended to. And all three of them are really experiencing this journey, this episode, this story at the same time. And people cope very different. I read something a long time ago that I always teach, which is that, and I don't remember who I read it from, so I'm going to steal it, but I'm telling you that, is that different means not the same. It doesn't mean better or worse. And so couples often cope with this very differently, and their supports are very different, and they're not the same. And if it works, it's about figuring out how that is. So thank you, Elisheva. I'm glad you added that in. Rachie, can you talk about a little bit the support you got, things that sounded right, things that didn't sound right, what kind of support you wanted?
Good. So I have three things I want to say. Okay, first of all, I've said a lot of stupid things. And it's, you think, me? I mean, I asked somebody how many kids they have, like me of all people, and she didn't have any. It was like, yeah, open mouth, enter foot. And I did it last week. I was selling over a vignette, and it was ill-placed. It was like, okay, that's it. What can you do? We're human, and we have to understand that people are human. So that's number one. And we have to try to be less human, whatever it is. We have to try to be as sensitive as possible, but we are going to mess up. And if people mess up on us, they don't have ill intentions, like Elisheva said, that we really do have to assume good intentions or cluelessness. I just want to point out one negative and one positive. So one negative, that after my kids were born, after we adopted them, a number of people said, oh yes, we've heard stories that people adopt and then they have their own child. Hello, these are my own children. So it's something that, you know, you think you're doing someone a favor, but you're really giving them a little slap in the face. These are very much my own children, our own children. And that's wonderful that people have biological children after they have adopted children, but they're all very much their own children. I also don't like it so much when they, oh, he looks just like you, or she looks like, you know what? We have eye to eyes. No, that's my own little hang up. I don't feel like they need to look like me to be my children. That's just, on a positive, I was interviewed recently for someone's book. And she sent me some glosses of it. And there was a wonderful line that I saw in the glosses of her book that, and I always appreciated very much when my friends put on maternity that they told me so, that I didn't just have to be, you know, like you would tell your friend, now they maybe post it, I don't know, but, you know, call, hi, Rachie, you know, I'm really thinking about you, I'm davening for you, and, you know, I'm putting on maternity tomorrow, which I always thought was very thoughtful. And I happen to appreciate that because I'm going to find out one way or another. And again, normalization is very, very important to me. But in this book, I saw a line that someone said to say, you know, hi, Rachie, I'm putting on maternity. Just give me a little guidance. How do you want our conversations to proceed through my pregnancy? And I thought that was like such a smart, brave, smart thing to say. And, you know, say, I could say, you know, I only want to hear about your spaghetti meatballs for dinner. I do not want to hear about your ultrasounds. Or I could, or whoever it is can answer differently. And I thought that, you know, being sensitive and upfront is really important. I learned this from Esty Teitelbaum once. I saw her, and she's the queen of finesse. And I saw her helping an elderly person into the car, and she said so nicely, tell me how I could help you. And I thought that was brilliant. You didn't have to, you know, dream it up. Just tell me how I could help you. And we have to be a little brave to do that, but I think, and a little brave to answer honestly, which is important. But yeah, those are my thoughts.
I appreciated both the open-ended questions, right? Tell me about your family instead of how many children do you have, which is what I always tell rabbis or clergy when I try to do trainings with them, right? Tell me how I can help you, or I'm just here for you, all those open-ended things. And Rachie, I just want to echo one thing you said that I think I say at least 10 times a day to people, which is that we're all only human. We're human, and so we're supposed to be these very complicated, emotional beings, and we say things and we make mistakes, and the road is not always smooth, and we can only expect ourselves to be human. And so it comes with disappointment and loss and hope and love, and it's all a very complicated road. I'm going to pass it back to Renee for some final comments, and then I'm going to leave it to Renee as we covered some of the Q&A. I don't know if we have time to do more. If we don't, all four of us are available if anybody wants to contact us separately. So I'm going to pass it to Renee for some final comments and guidance on timing.
Thank you. We've learned so much from listening to all of you, and we are grateful to you for having this conversation and letting us listen in. Unfortunately, we do not have time for audience questions, but as Aimee said, please check the chat for our panelists' contact information so you can contact them directly. Please check the chat as well for a link if you would like to make a contribution to support this event or future events like it. The link will take you to the Mikvah Society website where you can make a contribution to the Robin Nyman Mikvah Education Fund. You can also there connect to the Mikvah Society for membership as well. Karen, thank you very much for moderating this important discussion and for your sensitivity in helping us plan this evening. A very special thank you to Aimee, Elisheva, and Rachie for sharing your personal stories, for helping us all gain some insight and understanding in how we can be supportive of our friends, neighbors, and family members who may be going through this silent struggle, and for helping us understand how Mikvah comes into play in dealing with infertility and pregnancy loss. As I mentioned earlier, the next event of the Robin Nyman Mikvah Education Fund will be on February 10th, titled From Quarantine to Connections, Strengthening Our Marriage During Challenging Times. Please keep an eye out for more information. Thank you all for coming, and good night.